Hi, my name's Lisa McNally. I'm a Director of Public Health for Sandwell. It's Mental Health Awareness Week. Bit of a strange one, I suppose, in that we're all locked down because of the pandemic, not able to see our family and our friends. But I've seen some really positive stuff online this weekend. People sharing their story about their own mental health online, which I think is great. So this is my effort. This is me having a go at that. I want to think in particular just for a minute about the two sides of mental health support. So on the one side, you've got the giving of mental health support. When someone asks for help, there's that side of offering support, offering help, listening. And on the other side, there's asking for mental health support. There's asking for help, reaching out when we need it, when we're in distress. And I think for me, those two sides of mental health support, the asking for it and the receiving of mental health support, have really come into sharp focus. I'm a psychologist. I trained as a psychologist many years ago now. And then I moved into public health. So I spent many years working as a professional offering support for mental health. And also I'm someone who has lived with a mental illness my whole life. I was a bit of an early starter in that respect. I first experienced mental health problems probably at the age of 4 or 5, I think, and obviously had a difficult time as a child living with mental health problems. I self-harmed quite badly, which didn't help at all, just left some really ugly scars for me to deal with. But here I am. And I remember one night, the two sides of mental health support, the offering support and asking for support, really come together for me. I was nearly sectioned onto a mental health ward, a psychiatric ward in a hospital. And one of the reasons they agreed to let me go home and be cared for at home was because I was supposed to be working on that mental health ward the next day. So those two sides of mental health support, asking for it and also being someone that gives help, really come crashing together, I suppose. And it just shows how they don't occupy two separate worlds. I think things are a lot better than they used to be when I was younger, back in the 1980s, a long time ago now. People didn't really feel comfortable or as comfortable asking for mental health help. And also people, apart from professionals, didn't feel comfortable about offering support for mental health. I think we're much better at that now. Things aren't perfect. Obviously, kids are waiting far too long for mental health treatment. So are adults, actually. There's not enough funding going into mental health services, but as a community, I think we're much better at both asking for mental health support when we need it and also offering help to other people who are having mental health problems. And that's got to be a good thing. I think we're much more rounded individuals maybe now when it comes to mental health. So really that's it, except to say there's loads going on in Sandwell, the voluntary sector, the community. Since I've been here, I've seen so many amazing projects happening that are geared towards supporting mental health. And if you've got any ideas for how we can help create more of those projects, if you've got an idea for how you can maybe improve mental health in your community, then get in touch. Obviously, we might be a bit restricted to online stuff for a while, I don't know, but get in touch and let's see what we can do. And especially as we start to come out of this pandemic, let's hope that's not too far away, maybe we can get some new projects going. But for now, thank you for listening to my video. Really appreciate it. And look after yourself, take care and stay well. Bye.